Hello, I'm Los Angeles City Councilman Paul Krekorian, and I want to thank you for joining us for this forum on resources that are available to people who are unemployed or struggling because of the economic consequences of the COVID-19 crisis. We're obviously living through a time that's unprecedented in our history, and the public health catastrophe that COVID-19 has caused to our country and really to the world is something that none of us have ever experienced. But equally catastrophic is the economic consequences that have come from it. And as we struggle to ensure that we keep people safe, that we keep fighting against the tremendous public health consequences of this virus, that we try to keep people alive, we also have to continue to ensure that we're keeping, as we keep people safe, that we're also making sure that they are able to take advantage of all of the resources that are available to ensure that their economic health is preserved as well. So I'm very pleased to have three panelists with us today who can offer a lot of information to those who are seeking it, because we know that with the dramatic increase in unemployment that's come with businesses closing down, that there's been a lot of frustration as well out there. People who've tried to get government benefits and haven't been able to. People who've been calling phone numbers and trying to go to websites and found that they've been overloaded and that there have been delays. And so we're going to try to cut through a lot of that and to try to provide the information that you need to be able to get the resources that you're entitled to and that will help to ease some of the economic pain that we're going through with this COVID-19 crisis. So this, of course, includes not only unemployment benefits, but a lot of things that come with being unemployed as well, like the loss of health insurance. And there couldn't be anything more important right now as we're battling this virus than ensuring that we maintain continuity of health care as well for people. So these two issues are inextricably linked, and we're going to talk about that at length with the experts that I have available on this panel today. So first, I'm very pleased to be able to welcome and introduce Gary De La Rosa. Gary is a longtime city employee and an expert in the areas that we're talking about, and in fact was working really hard, has been working for 10 years with our department on economic workforce development in helping people who have lost their jobs long before COVID-19. So when a company closes, Gary is one of the people in our rapid response team that goes in there to try to ensure that all of the employees are connected with the resources that are available to them. And so I'm really pleased to be able to introduce Gary De La Rosa, who is going to help walk us through some of the issues involved with receiving unemployment benefits. So Gary, I'd like you to start, if you can, with just kind of giving an overview of how people should be applying for unemployment insurance, and what are the problems that you've heard about that people are having already in getting their unemployment benefits, and what should they do to overcome those problems?
Well, thank you, Council Member, for inviting me aboard and all of us so that we could help out our communities. We appreciate it. First thing that we would do in a normal situation, and normal would have been January, we would bring in a whole team of people from UI, Employment Insurance, from the EDD department, someone from healthcare, so DOL, who is here today, thankfully. And we would have the meetings so that everyone could come in, and we have a packet of information we hand out, and then try to help them through the guidelines of what you need to do. Well, as I'm sure everyone's aware, getting a hold of UI right now is extremely difficult. I'm not going to lie. It's very, very hard. But you have to kind of think of it as this is your job right now, full time, to try to get a hold of them. So in terms of trying to put in for your unemployment, the best way to do it is actually to do it online, because it allows you not to make any mistakes. A lot of people still try to call in, and you can even mail it in. But the best way is to try to get online, and UI itself is actually open from 8 till noon. There is another number once you've gotten in where maybe you have problems or a question that you can phone that's open from 8 to 8. but indeed, they're overwhelmed at the unemployment insurance. They have, I was told a few days ago, hired some new workers, but they are now in the situation of having to train them. So I just want you to be aware, yes, it is difficult. You have to just be vigilant. And one of the most important things is make sure you have all of your information properly in front of you so that when you do get a hold of someone or you do get online to apply, you have all your information correct. I'm going to throw a couple of things that we hear all the time that cause problems. Someone puts in the wrong social security number. Someone puts in the wrong California ID number. Someone has maybe two last names that they use, but they only use one on their check, and then they apply for unemployment with both. That becomes a red flag for UI. One of the things, and I know this is unnerving at the moment, but in January, this is actually a plus. UI doesn't want anyone to steal your money. So if there is something that does not match up exact, they're going to throw it to the side and then do some research. But unfortunately, right now, you have thousands and thousands and thousands of people that they're dealing with. Okay, so you have to go. If you go onto our website, EWDD's website, there is a place that you can go in, and we have where you can sign up for one of our orientations. We do them twice a day, Monday through Friday. And you can also download a packet of virtual information. And one of the sheets is a sheet that you can use that has, we call it a cheat sheet. It has all the questions and information that you need to have available to apply for unemployment. If you take that and fill it out, you're going to decrease your chances of making a mistake, especially if you go over 3 or 4 times. So that is where you're at. And real fast, the moment you become eligible to apply for UI. So for example, today's my last day at 5 o'clock. At 5:01, I can start applying. So we ask people to jump on it as soon as they can. Don't delay, don't wait, especially now.
And Gary, for people who are applying for unemployment for the first time, this is obviously an unusual time. How long is the delay between the time the application goes in and the time when they can start to expect to receive their benefits? And how long will those benefits last?
Great question. So normally you have about a 7 to 10 day, waiting period. So my last day is today. The way UI works, their work week is Sunday through Saturday. So you'd have to wait the rest of this week and then another week before you were then eligible to begin receiving monies. Currently, it is today is my last day. Tomorrow, I am eligible. The key, so I'm going to get paid starting tomorrow. I don't have to wait 10 days. But the problem is going to be getting through. I have to just be honest. You're going to have to get in. However, let's say it takes me 20 days to finally get in, and tomorrow is my first day without pay. I will be back paid to that day. Okay? Your normal unemployment insurance is good for 26 weeks out of a year. So you're eligible for 26 weeks out of 52. That's a floating line, okay? So let's say I am out of work for a month. I start to receive my unemployment, and then I pick up a job for 3 months. You just close down your claim, go to work. When that ends, you reopen your claim. So within a 52-week period, you're eligible for 26 weeks. Now, those that applied earlier, who were let off at the beginning in March, there is a 13-week extension, but that ends at the end of this year, okay? So we don't know yet if it's going to be extended into the next year. All we know for sure is it ends on December 31st, all right? So 26 weeks over 52 weeks. And again, you can open and close as need be. I do want to make mention real quick, council member, that if during that time period, let's say someone in your family becomes ill and you have to be a caretaker, you can close your UI claim and open up a paid family leave claim, okay? And it does not take away from your UI benefits. Conversely, and knock on wood, this doesn't happen, but should you become ill with the COVID, you can also put in for disability. These both are being brought forth because of the COVID-19 situation. So I just want folks to be aware that those are also there for them.
Very good. And by applying for those other benefits, they would preserve eligibility for unemployment in case it should become necessary in the future if their business should shut down again, for example.
Yes, you're absolutely right.
Great. If someone is having trouble with their application, if their benefits have been rejected, if there's some problem with that, where do they go for help?
Well, everything still has to go through the EDD website, okay? And the website looks a little bit like this. Well, it looks a lot like this. This is the website. And there's an area here called Manage a Claim, okay? And so this does become a problem, and I'm going to kind of give a little hint. Hopefully this works. It has helped some people. If you put in for a claim and then you feel as if, well, they're saying that you're not eligible, or you have a problem suddenly not receiving.
Looks like we may have to come back to Gary. I have a couple more questions, and he has a couple more thoughts, but while we're waiting to get Gary back on the line, what I'm going to do is go next to Michael Kwok, who Michael has been working at the U.S. Department of Labor Employee Benefit Security Administration as a benefits advisor for over 10 years. And I wanted to have Mike on this panel because, of course, when people lose their jobs, unfortunately in this country, most people get their health insurance through their employer. And so very often when they're unemployed, they also lose their health coverage. And so there are federal programs that are available to help people in that situation. One of them is COBRA. And I'd like Mike to start, if you can, by describing what COBRA is, how a person applies for it, and what sort of benefits are included in the COBRA program.
Thank you, Council Member. I'm honored to be here. COBRA is basically nothing more than a law that basically allows you, when you don't qualify for insurance anymore through your employer, to continue that. The reason you may not qualify anymore is because, one, you are not working enough hours anymore to qualify for insurance of that employer, or unfortunately you're let go because of layoffs or for whatever reason. So it gives you that right to continue that insurance of that employer, in a nutshell.
Okay, and so
now,
go ahead.
How does it really work? Thank you. How does it really work? There's several ways. Majority, it happens in the following. If it's a small employer, a lot of times they may administer the COBRA benefit in-house. But a lot of large employers may outsource that to a third-party COBRA administrator. So the timeline is the following. Once your medical benefit ends from that employer, they have a total of 44 days to send out a COBRA election notice. That's basically your enrollment form. Sometimes they may even email it to you, but that's rare. It still should be in mail format. So please pay attention to your mails. If you may not recognize a big package coming from a third party. So please just open it and see what's in it. There is time sensitive because once you receive it, you have a 60-day window from the date of that notice to decide if you wish to continue that insurance of the own employer using the COBRA law. If you do, you will have 45 days to make the first payment because you have to pay all the months in arrear. Going back to the date the benefit ended because COBRA is retroactive. What does that mean? So if you experience any medical expenses or a medical emergency and you paid out of pocket between the period your medical benefit ended and when your COBRA is activated, you may have paid out of pocket. Please save your receipt because once everything is activated, you can submit a claim for reimbursement. So that's the reason why you're technically protected even during this window that's gray. And then once everything is activated, normally premiums are due the first of every month. Please make sure if you're mailing it, make sure you mail it with enough time for the mail to get there, and do it in a way where that you have confirmation, a tracking number. If you're doing your payment online, make sure you have a confirmation. And COBRA is good for 18 months. But the thing right now is due to the President's declaration of national emergency because of this pandemic, a lot of these due dates have been extended beyond the 60 days and when the national emergency declaration ends. So unfortunately, you still have to pay all the premiums in the rear, but you can still get it activated and you won't lose your insurance, especially under this kind of situation we're experiencing right now.
So in a nutshell, if someone loses their job, their health insurance ends with their termination because it's being provided by the employer. But under federal law, that employee has the option of continuing the same health care coverage, but then the employee will be expected to pay for it after their job is terminated. Is that a fair summary?
Exactly.
Okay. So
it is, yeah, but you pay the full cost of
right.
that insurance plus 2%.
Now, needless to say, that gets very expensive. And especially for somebody who's lost their job, sometimes that's going to be really tough to be able to pay for that coverage. So what sort of assistance is there? What if someone can't afford to pay for the full cost of their health care under COBRA?
Well, right now, there's not any assistance that's coming through Congress right now. Back in 2008, there was a program that was passed called there was a COBRA subsidy that happened for the 2008 economic slowdown or recession. But unfortunately, nothing has happened right now. But keep in mind, there are other options. Number one, if you have a spouse, that also works for an employer, and they may have a employer health plan, you have a special 30-day enrollment window to jump onto that employer's group health plan. Now, another option is COBRA California. Look, COBRA California, because with the Affordable Care Act, has established a marketplace for individuals to seek health insurance. And there's a lot of time it's based on your income base, how much you pay. There is a special 60-day special enrollment window. So please be aware of these two options available to you as well.
Great, and that's actually a terrific segue because we also have with us Jose Rodriguez Jr., who is a Covered California certified agent. And I'd like to invite Jose to join the conversation now and talk a little bit about what Covered California is and how, if someone finds themselves in a situation where they've lost their health insurance, how do they apply and what sort of benefits are available under Covered California?
Of course. Thank you very much for your invitation. It's an honor to be here today. Thank you. Covered California is indeed all like COBRA. It's a law. It's in California, the law is a Health Care Act, ACA, but in California, we call it Covered California. And what Covered California is also known as a marketplace. This is where people can come in and have a variety of companies to select from, as well as different types of options of insurance plans to select from, like HMOs, PPOs, and EPOs. So depending on how they file their taxes and how much income there is moving forward from the day that they apply will dictate how much money the company, the government, Covered California, will have available for them in a way of a subsidy, so they can apply that towards the purchase of a plan. And they can apply that online or calling directly to Covered California or using a certified agent like myself to help them this way.
Okay. And so how do the benefits under Covered California compare to typical employer-provided health insurance? What are the benefits? What are some things that might not be included?
Well, that's a very good question. So there is a little difference between both of them, but in reality, there isn't a lot difference between the level of plans. There is 4 different levels of plans to select from. There's bronze, silver, gold, and platinum. And employers will also have the similar type of plans available to the employees. And once they enroll in those plans, they will have one of those options available. So let's say that an employee came in from an employer plan called Gold Select. That's a gold plan from an employer plan. well, they will also have the ability to choose a same level of coverage plan in the marketplace of the same type of coverage, but their summary of benefits will help us agents know what kind of coverage they had before, so we can help them select something similar to what they previously had and explain the networks of different doctors to select from. Because sometimes the doctors are different from HMO to HMO or PPO to PPO. And it all depends on the employer's networks and what's available in the marketplace. There's two different ones.
And that's very often an important issue to employees. The continuity of care that they would get from a particular healthcare provider might be disrupted here if they have to choose to go to Covered California rather than maintaining their existing coverage under COBRA, right? Because under COBRA, they would be able to continue on with their same healthcare provider, but it's typically much more expensive than a policy that they would get under Covered California under the Affordable Care Act. Is that right?
You're definitely on point. And this is probably one of the reasons, the only reason why I feel that it makes sense to have COBRA is simply because if you have a procedure that you're undergoing that you've been waiting for so long to go through, and this event creates an interruption on that treatment or so on, and changing doctors, changing medications, and changing flows is just going to create a big headache. Maybe it's just best to pay for COBRA because that will alleviate that particular issue. And it's cheaper to just have COBRA as your the plan that you have. Thank God for it, that way you're not interrupted for those particular ways. And then move into a different plan later where it makes more sense for you in certain cases. But when you speak to an advisor, we'll be able to let you know how to properly treat it, so that you're always in accordance to what the law says.
And can you talk a little bit about how coverage under the Affordable Care Act interfaces with Medi-Cal? A person who has lost their job and maybe is really struggling to make their rent, has gone through their savings, at some point they're likely to become Medi-Cal eligible. So can you talk a little bit about how that program works, what it takes to be eligible for Medi-Cal, how you apply, and how that impacts someone's decision on pursuing Covered California coverage?
Yeah, this question is pretty wide in regards to the different types of ways how to apply and qualify for Medi-Cal, because you can have Medi-Cal for simply being under low income. But what creates the opportunity is the fact that you are a U.S. citizen or a legal resident of the United States. That's what creates the eligibility factor. Once that eligibility factor is created, then we need to know if you qualify for it. Now, qualifying for it is understanding what level of income you are in at this time and how you file your taxes. So if you're a single person with no dependents, then you have a level of income of 138%. If you're 130% below is where you're making now moving forward, projected for the rest of the year, then you're going to qualify for Medicaid. Medicaid in California is called Medi-Cal. And Medi-Cal for the citizens free health insurance. And the reason why he qualified for it is because he was below the federal poverty level moving forward at the time that he applied for the application on his year that he's selecting to become enrolled. I don't know if that made sense. Now, the federal poverty level, Mark, is very important to understand it, because for each and every single one of us is different. It's different for the one that's a single person or a single parent or a parent of two with two dependents or one dependent. So that mark always goes up because it tries to calculate two sources of incomes in the event of a marriage or so on. So for you to understand how to qualify for Medi-Cal is understanding that if there is no income for you and you have no income coming in, most likely you're going to qualify for Medi-Cal, because the government wants to assist you to have an affordable plan for you to have while you're undergoing what you're undergoing, losing your job or your health insurance plan. Then once you are already earning income, now once you have income coming in, like unemployment or some sort of retirement, you may have some extra money coming in from a part-time job that is still flowing through. So if that's the case, then you're probably going to be right above the federal poverty level. And that's when you don't qualify for Medi-Cal to be for free for you. Now you have to go get money called subsidy from the government so that they can help you pay for insurance. And that's the functionality of Cover California.
Now, Medi-Cal, of course, is a federally funded program administered through the state.
Through the state.
And so if either of our other speakers want to offer any thoughts that Jose didn't cover about Medi-Cal, I'd welcome them. And including if someone has problems in applying for Medi-Cal, if they have been denied, if benefits have been denied, those sorts of things, I presume that the best place to go would probably be to their state legislator's office to help to guide them through that program. But if either of you have any other thoughts about that, please go ahead and share them.
Well, I'll just close it out that in getting to understand what insurance plan is very hectic to operate on your own. So it's important that you always utilize somebody that's an expert in this area, such as a certified agent like myself, will be the best way to help you get those questions answered as you're going along through this process.
Great. And I know you, Jose, actually offer some other financial literacy kind of counseling, and I wonder if you or Gary, I see that you're back with us now as well, if you have any thoughts about people who, the markets are down, people are worrying about their 401ks and their retirement savings. Some people are tapping into those sources of funds just to get through the month. What tips or advice can you offer to people who are worried about the sustainability of their retirement funds and who are having to actually utilize some of them now?
Yes, I can speak into that. I've been a financial advisor for now 10 years and experienced the downfalls of the market and so on. And 401ks are they're a very particular important role of a financial planning, and that particular plan is solely for retirement. So COVID-19 and this event that we're undergoing has created certain flexibilities into aiding into tapping into those accounts. And if you don't have a financial advisor to teach you or try to give you an advice into how to and why would it not make sense to tap into that account, maybe you want to use other funds in your financial planning time, maybe it would be best to experience that instead of tapping into your 401k. But it is important that if you're moving from an employer and you're losing your plan and you're losing your job and you have a 401k, then it is important that you know that you have a certain period of time to roll that money over into an IRA. So the first thing to do is and the first opportunity that people have is start searching for a candidate for themselves they can trust, and they'll be able to consult with them and understand what will be the best option for them at that time to invest or reinvest or move their money at that time. But it is very important that you know that you only have a period of time to do this.
Yeah. Gary, I saw that you wanted to add a couple thoughts as well. Go right ahead.
In terms of getting help with a financial education, we do have 6 different folks who help work with us, and it's for free. You don't have to pay, and Jose as well. You can call Jose. If they come into the EWDD website and get into our section where you can sign up for an orientation, there's a survey. You fill that out and then send it to us. You are in our system, which then allows anybody who has taken an orientation with us to access for free any services or resources we have. And we do have folks that will give you 45 to an hour of free time to discuss your personal situation, because like all things, every person's situation is a little different, right? What Jose was touching on is that often when you do tap into your 401k, you're going to lose about 20% right off the top. So they want folks to understand what their options are. There are some different things going on now as well, as I understand it, but we do have experts that can handle that for them. So that is something that Rapid Response will offer to them for free.
And Gary, can you give the URL for how people actually gain access to that information?
Let me find it. Well, what I advise you to do is just go into the Economic Workforce Development Department website, and immediately at the top, you'll see job loss and resources, and that's how you click in there, and that's how you access us.
Terrific.
Everything, and they'll have all the information that we would normally hand out for an orientation, all the resource guides, everything available to them. So please take advantage of it, everybody.
Very good. Thank you. And we also have all of that information on my website. So at the end of this meeting, we're going to have that information up, and people can go and find all these resources on my website as well. So, Gary, I'm glad to have you back. What I wanted to go next to with you is we talked quite a lot about unemployment insurance, which, of course, again, is not a program that is directly funded or administered by the city, but the city has tried to fill the gap as best we can in certain areas. Can you talk a little bit about some of the other city programs that are available for people who are really struggling through difficult times right now?
Absolutely. So one thing we have available are the WorkSource centers, or America's Job Centers, and there's 16 of them across the city of Los Angeles. They are going to be your contact point for services and resources that are available from the city. And so you can, again, get this information. The sheet will look like this, has a list of all of the different sites. All of the resources that they provide, they all have core resources. So if you need help with resume writing, interview techniques, maybe there's a training that might be available, please take advantage of going through there and taking a look at what they have available. Again, these are all at no cost to you. And they're also going to be able to help you look for different services that are out there. Other things that we have, there is the food bank that people have need access to food. We have the food pantries across LA and LA County. Those are available. You can go on the website and they can put in an email address and they'll click up which one is close to you. So those are there and available. We do have also a LA Regional COVID Fund, which people can check into. And that has a lot of different resources available there for them to access to. Also, again, there is free COVID testing. And I want to make sure people know about that. If you can't afford to pay for it, you can still access it. All right. And you can go again onto the LA. I'm sure you probably have it on your website, the mayor's website, or LA County. All of that information is there, and please take advantage of it. I also wanted to, before we got cut off, I was just going to mention that in everything and anything that you fill out from this point on, whether it's for unemployment, whatever, if you're asked why you're not working, please put down COVID-19 and make sure everybody understands it's because of the pandemic. All right. That helps speed things up rapidly. Some people put down, oh, I'm laid off. Well, then they have to, especially unemployment insurance, has to investigate that. But if you put COVID-19, it's understood what that means.
Right. Now, what if somebody is not a regular employee of, on the payroll, but a gig worker or somebody who's a small business owner who, or maybe a solo employee of their own business? What sorts of options do people in that situation have when their income is lost?
Okay, so there's the PPP. There are these programs that have been set up to understand that there are these, like you're saying, gig workers or people that were in a different situation that normally in January would not be eligible for unemployment insurance. But this is a worldwide emergency. And so we're asking everyone to step up, right, to stay home, to stay close to home, to help this pandemic disappear. And so there are resources. And if you go on the EDD website, EDD unemployment insurance website, you will find these programs. So do take the time to read through. There's a section for them to go to. They can also just type in PPP, and that information will start popping up on the website. And I'm sure you probably have it on your website. I wouldn't be surprised, council member. I know how sharp you guys are on getting that there. But there is help there. It's a little bit different than the regular UI. So you do need to take a little time to read through it and study it to make sure you're going the right direction. Now, early on, a lot of people who really were gig workers put in for regular UI, and there was some confusion, but UI was initially given it to them anyway, regardless. Right now, you do have to separate a little bit, and that's basically what you have to do.
So you're right, we do have some of that information on our website, but I do want you to clarify for a moment, because in government sometimes we throw out a lot of acronyms. And you mentioned both the EDD website and the EWDD website. Can you just explain what the difference between those two agencies is so that people understand that some of these things are available from different branches of government and they need to go to different places to get them? So if you could just explain those differences.
Absolutely. EWDD, Economic Workforce Development Department, is a city department, City of Los Angeles. The EDD is based out of Sacramento, so it's state agency. They oversee the monies that come through for unemployment insurance, et cetera. And by the way, they do have, once you've put in for UI, this is something we didn't get a chance to touch on, they have a work services branch as well that will help people through CalJobs, through the labor market information, to access information about jobs, about trainings, again for free, things that you could do to be proactive. CalJobs, for example, is free. You can put up to 10 resumes in there. And not only will you be able to look for work, but employers will be able to look at your information and potentially contact you. So EDD is state, and EWDD, Economic Workforce Development, is in the city of Los Angeles.
Great. I do want to just sort of, as we wrap up the conversation, close on the forward-looking optimistic note. And that is that it's terrific that all of these resources are available for people who are in great need right now. But it's clear that the need is much greater than the resources that are available to help people through at the moment. Because as you mentioned, Gary, this is a global crisis with global economic impacts. But at the same time, there are parts of our economy that are doing very well right now. There are businesses that are hiring people today and are in great need, actually, of employment today. And there are city web portals and others that help to connect people to those jobs. If you can speak to that for a moment. If people are tired of being called back to their old job and they think that maybe that may or may not happen, where are the places that they can look to find new employment?
Great point. Sometimes in the bad situation, there's a silver lining. And we have talked to people. One thing we talked to them about is looking, maybe starting their own business. Maybe they start up a cottage business where they're creating masks, for example. One of the places you can go to is the labor market information. They have a listing of what is trending up now and what's trending down, so that you don't try to go into a field that's not going to be there. Obviously, we don't know what the other side of this is going to look like as of yet, but it is very smart to take a proactive point. So looking at labor market, going through CalJobs, going to a local workforce center, and asking folks, well, what are the things that are popping up now? What jobs and what needs are currently out there? And you're absolutely right, Councilmember. There are some places that are hiring because our needs have shifted differently, whether it's food delivery, whether it's stocking. There's a lot of different things that are popping up, some that we're not even aware of at this moment as we speak. But do be proactive and do take advantage of all of these things and take advantage of the rapid response. We have information that comes to us that we send back out. So again, if you were to come into our system, we can access you as we send out information about new services or new resources. We do get a lot And even recently, we received a lot of information about job fairs, virtual, of course, but they are there. And the worksource centers, although they can't have the numbers of people they used to have coming in because of social distancing, you can still make an appointment with them to go in and have that discussion. What do I want to do? Maybe I want to do something different. What are my talents? What do I need? Also, before I forget, there may be some of you out there that are maybe a course away or a certificate away from moving up in the field that you're in. Speak to a workforce center to see if there's a way we can help you. Go through the labor market information in CalJobs and see if there's a course that you can take that would help change your life, help make you and put you in a better position when we get to the other side of this, and see if we can help you do it for free.
Terrific. Thank you, Gary. And Jose, Mike, I wanted to give you an opportunity if you'd like to offer any closing comments or anything that we didn't touch on with regard to healthcare in particular. If there's anything you'd like to add?
I would just like to say that our office, we have operating hours are from 8 to 4:30. The national number is the actually local number, 626-229-1000. So if you are experiencing anything related to your old employer's medical benefits and you're having some trouble with claims or with your 401k not be able to complete your distribution, definitely give us a call. We have representatives such as myself here able to assist you live. So please do not miss the opportunity.
Thank you very much.
Thank you.
And the best way to search for a best certified agent is going to the COBRA California website and just search for an agent locally. There's several ways. COBRA California has a very limited amount of employees, so a lot of the enrollments are being distributed out to agents like myself so that we're able to help them enroll into a plan. So looking for that, and obviously you got to make sure that it is a NAIFA or NAHU certified agent that gives you the ability to understand that that agent is active and constantly involving himself on learning about the new updates on legislation. So just as long as you know that you have that as your agent, then you can trust his source and know that you're going to be helped correctly.
Thank you very much. Gary, anything else that we didn't cover that you'd like to mention to folks who are struggling right now?
I do want to touch real quick, Jose. If someone has not had their health coverage for a month or so, can they enroll COBRA California right now?
Yes, they can. As a matter of fact, the COVID-19 event has created a special enrollment period. And as long as people use this, you will have an effective date of August 1st. So please don't hesitate to make the call. Know that if you don't have insurance now or never had insurance and you didn't really have an enrollment, you didn't have a plan through your employer just because your employer didn't offer you a plan and you just don't have an insurance plan, this is a great opportunity to use COBRA California and see what kind of benefits you can qualify for. So yeah, I'm glad that you asked that question.
Okay. And furthermore, I would just say that we have a lot of resources available to folks, and we hope that you take advantage of them. That's why we're here. And I want to thank you, Council Member, for doing this. And I want to thank and the panelists, but also I want to thank all of those folks out there who have been the ones that have been our small little heroes by wearing your mask and staying at home when possible, and just being a part of a process of something that's very historic. And we are part of this, and hopefully we get through this in a much better way, in a better stage in the next year.
Well, you're very right, Gary. And, you know, some of the challenge that we're having, in fact, the bulk of the challenge that we're having in getting the economy going again, is that people are not wearing their masks. I have mine right here. I know all you have yours available. When you are outside, please wear the mask. follow the social distancing guidelines that government has been providing, that healthcare professionals have been providing. Continue to regularly wash your hands. If we take the basic steps like that, it makes it much easier and much more likely to be able to open up more businesses, more recreational opportunities, all of the things that we all want to do and that we want to go and see get back to normal will be back to normal sooner if everyone does their part by just maintaining the simple public health guidelines that everybody has been hearing now for months. If you just do your part, it will make it that much easier for the economy to begin to recover and for people's lives to be saved. We all owe that obligation to one another. And as we wrap
if
up,
I may,
yeah, go ahead, Jose.
I'm sorry. I just was brought to my attention that I just mentioned that you can only make a phone call to get this enrollment going for yourself, but there isn't. There is also the online option, so people can just go in at any time throughout their day, go to the Cover California website and sign up. Try to do the process on your own so that you can give them. It's very easy going. It's very easy process to go through that process if you're familiar with the internet. If you're having challenges with the internet and you cannot apply on your own going to the website, then if you feel assistance is needed, then there's a little icon with the question mark on the website. You can go there and use the chat box to have somebody help you out or find an agent nearby you, but try to explore the online option too as well. And I'm sorry I didn't give that option before.
Thank you for that clarification. I know that makes it much easier for folks. So as we wrap up, right now the federal government is considering what additional aid it might be able to provide to people who are in need. I think it's important that everybody let their federal representatives know how important it is that we have robust help from Washington, D.C., because we've talked about a lot of these resources that are available. Most of these are not programs that are provided by your city government. It's things that are provided and funded at other levels of government where that's possible to do. Your city government has done more than most cities in trying to step up to respond to this crisis, including a $100 million renter relief program, for example, that was initiated under the leadership of our Council President Martinez and Mayor Garcetti and the full City Council for $100 million in relief for renters. We initiated, in addition to the PPP federal program that Gary mentioned, which provides support to businesses to be able to keep people employed and on the job, we created a small business loan program here in Los Angeles that serves the same goals for businesses that may not be eligible for PPP or where PPP help may not be enough. We've taken steps to ensure that the arts community, for example, has an opportunity to continue to stay up and running, and that performing artists and others who are struggling now have benefits that wouldn't otherwise be available to them. The city is stepping up. The state government is stepping up. We need Washington to continue to step up and assist us in being able to bring the benefits that the people of Los Angeles need to get through this difficult time. But I will say that the best sustainable outcome that will help people the most is by getting our economy up and running again, making sure that our businesses are able to thrive, making sure that our businesses are able to hire new people, bring back their former employees. And our council is committed to doing exactly that. The people of Los Angeles need to help with that by continuing to comply with the public health guidelines so that our economy can be up and running again sooner rather than later. And I'm confident that when it is, our recovery will be strong, jobs will come back, and people will be able to enjoy all that there is to enjoy about Los Angeles again very soon. So, Gary, I want to thank you, Gary De La Rosa from the Economic Workforce and Development Department, Michael Kwok from the U.S. Department of Labor, and Jose Rodriguez, Jr., the president of Optimized Financial and Insurance Services and the Certified Covered California agent. I want to thank you all very much for being with us, and thank you to everyone for joining us on this important forum. If you would like more information about any of the programs programs that are mentioned, you can go to my website, and we have connections to all of that information available there. So thank you very much for being with us today.